Hello everybody, and this video is about coronavirus symptoms related with coronavirus and a special feature that has just got available on CDC website named as CDC Self-Checker. And we are going to discuss that what are the things that we can do to protect ourselves from this pandemic. So, symptoms of this diseases are these symptoms may appear in like 2 to 14 days after exposure based on the incubation period of MERS and CoV viruses. It consists of fever, cough, shortness of breath. It's okay that if you feel sick, you just go to the hospital. But right now, based on a simple doubt, going to a hospital is not a good idea because you got patients there and there is a high risk of you getting the virus. So CDC has introduced a link in their website known as CDC Self-Checker. If you click over that link, you will find a whole questionnaire, and if you answer that questionnaire, they will just tell you that if you really need to go to the hospital. And the other symptoms that are emergency signs for COVID-19 are trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or faces. They're kind of pneumoniatic features. So it's like if you encounter any of these features, you should run to the hospital. The next is how to protect ourselves. There is currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to this virus via the following precautions. The first is maintain a 6 feet gap between people, as this virus spreads through droplets produced when an infected person coughs or sneezes. Everyone should wash their hands with soap and water for at least 20 seconds. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surface of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. The other precaution is to cover your mouth and nose with a cloth face cover when around others. Cover your mouth and nose when you cough or sneeze. This is something really interesting, that how you should clean and disinfect those stuff that are frequently touched. So the first step is either we can use diluting our household bleach. To make a bleach solution, mix 5 tablespoons, 1/3 cup of bleach per gallon of water, or 4 teaspoons of bleach per quarter of water. Follow manufacturer's instruction for application and proper ventilation. Check to ensure the product is not past its expiration date. Never mix household bleach with ammonia or any other cleanser. Expired household bleach will be effective against coronaviruses when properly diluted. So this precaution is really important while cleaning your surfaces that gets frequently touched. And the most important precaution that you can take is by staying home. So take care, stay healthy, bye-bye.